The International Coalition for Trachoma Control, ICTC, is a coalition of NGOs, donors, private sector, and academic organizations that are working together to support the WHO Alliance for the Global Elimination of Trachoma by 2020. The coalition was established to support national programs by advocating for and supporting the implementation of the WHO-endorsed SAFE strategy.
ICTC was originally formed through existing partnerships among the prevention of blindness agencies. We had worked together on ophthalmic training in Pakistan and expanded the partnership to work on prevention of river blindness. So the partnership already existed but needed to be expanded, particularly because we needed much greater expertise in the important areas of water and sanitation.
ICTC has played a significant role in increasing engagement between the WASH sector and the other sectors in the Global Health Programme. This has helped national programmes to become more comprehensive in their implementation of the SAFE strategy, and in turn, it's made gains to end trachoma much more sustainable.
The research community has always been an integral part of the International Coalition for Trachoma Control. As researchers, we provide the evidence base for policies, for best practices, for programs and non-governmental organizations, all of the partners that make up the ICTC group. But this goes both ways because we also are the recipients of good ideas, strong new operational research questions that help inform the research that we do so that together we can achieve the goal of elimination of trachoma.
The NGO partners and academics are able to play to each other's strengths. This means that the right partner is supporting each different country program. It also means, crucially, that there is no competition for resources between the partners, and we can act in the most efficient way in delivering drug and service.
One of the most significant moments for the coalition came in 2011, when 2020 Alliance was published. The document laid out what we knew or didn't know about the trachoma burden in each country. It created a sense of urgency and encouraged a new way of trachoma action planning to identify what needed to be done and created milestones to be reached in order to achieve elimination targets for 2020.
2020 Insight increased momentum enormously. It was a roadmap we could really stand behind. It demonstrated to donors and national governments that the trachoma community had a real plan and the expertise needed to achieve elimination.
The Global Trachoma Mapping Project was devised in order to help us understand exactly where trachoma was, district by district. All the trachoma programs rely on that data, and as a result we are so much more likely to be able to meet our targets to eliminate that disease. Sightsavers was incredibly proud to be able to lead this project with ITI and working with so many members of ICTC. It was a hugely collaborative endeavour, and we did this in 3 short years, reaching 2.6 million people across 29 countries. It was a phenomenal example of collaboration.
I think the most important thing people should take away from the coalition is the incredible importance of partnership to any global program. Partnership is not always easy and requires a commitment to working towards a common goal, setting aside individual ambitions and avoiding competition. However, working together to collect and share robust data, share work plans, and ensure different stakeholders' expertise are used strategically has brought in new donors and really put the community on a path to achieve the global elimination of trachoma.
The journey of ICTC has been an inspiring one. It shows what can be achieved when people come together around a common goal. However, the job is not done yet. We must continue to build this momentum. We must increase investment and scale up all aspects of the SAFE strategy. Eliminating trachoma will have enormous and immediate benefits for the communities affected by reducing poverty and suffering. We know what needs to be done. The time to make trachoma history is now.